Thanks for joining us today, Kelly. I think we'll just start with a brief intro about yourself and give us about 60 seconds of your background and a little bit about what you do.
Sure. Thanks so much, Riley, for having me here. And I'm excited to talk a little bit more about where we're seeing AI heading in healthcare. Currently a US digital health strategy lead at Samsung Electronics. And prior to that, was the head of BD for Honor, which is the world's largest home care company, and the head of new product solutions at Lyra Health, which is the world's largest mental health company. I also spent quite a bit of time leading some of the digital health practice initiatives for Monitor Deloitte, which is one of the world's largest healthcare consultancies as well. So have spent over 15 years in healthcare analytics and just really excited to meet with you today and share a little bit about kind of what I've been seeing across the whole landscape. Just on a personal note, have been really impressed with everything that HITLAB has done since on a personal level, angel invest in a large number of digital health startups and really excited about how you all have supported innovators here.
Thank you. Yeah, and that's an amazing background. We'll touch a little bit more maybe on some of the investing a little bit later in our chat. But first, I just want to start. You were at Vive in LA. Is that correct? I'm sure we had some other people there on the call, maybe that were there or joining or have been in the past. But what were some of the most exciting AI-centric discussions from this past week?
Yeah, it was just a whirlwind of 4 days, and definitely expect a lot of folks will have some similar reactions in the chat if you all just returned from Vive, and some of the themes from JP Morgan last month really carried over. You have a lot of the same healthcare executives who are all experiencing the same challenges in the industry. And I think we all know it's not that silver bullet, right? But it's really becoming that serious investment. And within the conversations at Vive, there are really three big themes that I saw folks taking a look at AI as a potential enabler. One, you can't escape the concerns around cybersecurity and securing health data. That's all over the news. Two, I think we were seeing so much conversation about care moving to the home. That was something that I was really passionate about at Honor as well. And then third, I think cost pressures, both the internal margin concerns and even just for that patient experience, your average healthcare, I think of them as consumers. Really, those cost pressures are, just a huge challenge for everyone across the industry. And circling back to that first one, I think, we know that securing health data is top of mind for the payers and providers who are at Vive, as well as the manufacturers and the tech enablers. We were all there to really help try to support the broader ecosystem, and whomever can really think about safeguarding health data in the best possible way, they're going to be the ones who can win the most trust with our ecosystem partners. And incidentally, having those ecosystem partners actually enables folks to really think about moving a lot of care to the home, really that second piece, that second challenge to think about how to move that overall experience and capture a lot of value, improve that quality. I think when you're looking at care in the home, there's just so much data that can be captured remotely. Stan mentioned earlier the ring and other wearables and watches, et cetera, that you're really democratizing a lot of insights for folks. And so it's engaging a broader set of folks across the family, their caregivers, different kinds of members that in the community who can support the broader movement, not just on the clinician side, since we know that there's such a huge shortage on the clinician workforce here. And lastly, I think the third theme I mentioned earlier is that the CFOs who are attending Vive were saying they really wanted to see those short payback periods for AI investments. And talking to everyone who was exhibiting at Vive, I think they're hearing that the back office use cases are just incredibly important to a lot of the folks who are attending. Overall, though, beyond all of the hype that is surrounding AI and large language models, it's the really key thing for me in my own experience is that integration and smooth implementation is really the true differentiator to forging good partnerships. So we can't forget just that baseline collaboration kind of muscle and strength there. Just as a quick example, I saw a really exciting announcement from Northwell where they're launching an AI catalyzer, and they're partnering with Aegis Ventures on different innovation studio initiatives in AI. We also saw different integrated delivery networks like Highmark announce a partnership with Google. And I think there's just a lot more to come with different kinds of industry collaborations that really move us beyond the hype and into areas that actually truly fundamentally transform healthcare.
Yeah, wonderful answer. Thank you. You kind of touched on a lot of different topics there, and certainly privacy and security, and with all this, collection of data in patients' homes, you want people to feel safe in their homes as well. I feel like that their data will be protected. What do you think makes 2024 this opportune moment for advancements in value-based care?
Yeah, it's a great question. When I first dove into AI 20 years ago, healthcare just wasn't quite as interested in either AI or in value-based care. And I think I really saw that shift about 15 years ago when the early adopters, one of the country's largest integrated delivery networks, brought my team in to help them to seriously invest into new AI use cases. And because they were one of the early adopters, I think a lot of providers and payers tried to emulate a little bit about in the back office side, right? So thinking about use cases in supply chain management or financial management, thinking about some of those predictive models and that at that administrative level. And now when we're really seeing the full landscape in 2024, everyone is realizing that there's a ton of value to move beyond the back office. And yes, that's absolutely crucial. But they also have to really consider that patient experience and that provider experience, especially with all of the clinician burnout that's happening, which directly influences patient engagement as well. So if you can really think through how do you transform a lot of these experiences between the patient and the provider, or even just between the patient and the administrative level, you're helping patients figure out, a more sort of consumer experience for themselves. They can have those more conversational sort of interactions that they expect in hospitality or that they expect in leisure and in consumer goods. So they're taking a lot of those expectations into healthcare, and ultimately that gives them really that sense of empowerment to figure out their own health and wellness journey. And it also ultimately bleeds over into how different healthcare entities can approach this. So one quick example is you're seeing a lot of the payers really think about how do you streamline prior auth, right? How do you remove that friction for consumers who have to take some pretty big steps with their care journey? If they're in that prior auth situation, they're already in a moment of stress. I think the second example there is, how do you help take clinicians out of the EMR, and all across Vive, you are seeing companies such as Augmetics or Abridge or Suki, others were really thinking about how do you really sort of transition that whole experience and rehumanize healthcare there.
Thank you. That's amazing, and we really appreciate all your insights. Unfortunately, we're at time, so we'll have to have you back on, and we can dive further into more investing around what you're seeing in 2024. But really appreciate you joining us today and sharing your experience and talking a little bit about what you're seeing in the markets.